Hi, I'm Dr. Julie Brown, trained concussion doctor, board certified chiropractic neurologist. Today, I want to talk about the TMJ, the temporomandibular joint, and concussion. First off, a little anatomy on the TMJ joint. This bone here is just hanging. It's not stuck to anything. It's only connected via soft tissue. So, in a concussion, whipping whatever direction, this is probably going to be free hanging. They have mouth guards, one to protect teeth. Maybe they're going to clinch, but if they get hit, it's just to protect so they don't go jamming their teeth together. And that's not really going to save the TMJ so much, but it's free hanging. Let's jump forward to you have a concussion. You have a vestibular system, for example, that is not working appropriately, and you've developed a little head tilt. Or your ocular system is not seeing things correctly, so you've developed a head tilt to try to manifest, everything being straight. With that, this jaw is free hanging. It's going to have different inputs. Some muscles are going to be shorter, some are going to be longer to hold on, and then next thing you know, you're getting headaches. You're clenching your teeth at night, which could be from other things as well. You are, I don't know, wearing your teeth differently. You're getting asymmetry to your face. I see that the most, especially with people who've had a concussion while they were a kid and still developing. So these muscles, they're all controlled. The chain muscles controlled by cranial nerve 5. The cranial nerve 5 and all the facial muscles are controlled cranial nerve 7. Sensory is cranial nerve 5, all of that. So that TMJ you can strain those muscles just like you can do an ankle. And then that cranial nerve 5, it has huge feedback into the brainstem. There's 3 branches. This trigeminal nerve has 3 branches. Its nucleus connects to every other nerve in the brainstem. It's a really big nucleus. That's why we like to do stimulation on it when we can use that as a tool, because it goes and it connects to other parts of the brainstem so that we can bring a level of activation or therapy, rehab to other parts of the brain. Sometimes it's too hard to go direct into an area, but maybe we can do different things to stabilize eye movements, for example. But this TMJ, I commonly see it. It's usually one of the things I'll treat later on someone because I like to get you oriented. It doesn't make any sense for me to go work a bunch of muscles if your head's still going to be tilted, right? That's still going to hang crooked. But that being said, maybe working on that is going to work back into the brain appropriately to help it rehab. That's possible. But I typically find that I will do vestibular therapies first, vision therapies, and then I'll slowly start addressing the TMJ. With the TMJ, you can get trigger points. You can get headaches up to the same side. You can Google trigger point maps TMJ or masseter or temporalis, and you can see it just lights up the whole brain. So I'll do a lot of therapy on it. I have had a few kids with concussions, and they've been females, and they have kind of this asymmetry to their face. Your smile's off a little, it's a little crooked, but it's just because and they were contact sports. They were soccer. They were contact sport. I think one was cheerleading maybe. And what happened was they got this concussion at an earlier age, and you get rid of the symptoms, your sensitivity to light, whatnot, but maybe you start to get this headache again. Maybe you don't. I don't know. Or you get a second concussion and now your symptoms are showing. But what happens is your symptoms go away. You don't do anything. The doctor said to just rest. That's all you need to do. Really, you needed to have your otolithic and vestibular system tested because that cerebellum is still developing. That cerebellum is a little part of the brain that it talks to the brainstem and the vestibular system. It's the only sensory organ that gets direct access to that cerebellum. And those layers are developing. You have to get those addressed so that those pathways are firing appropriately so that you have proper posture, because posture is a reflex. You can think about it for a moment, but it's a reflex. It gives away what's going on in your brain, your posture. And correct that, then work those muscles. But again, I see asymmetry commonly with kids who had a concussion when they were younger. If you have any questions, feel free to leave them in the comments, and I will be back again with little tidbits on concussions later. Bye.